1. US rejects WHO pandemic changes, what it means for global health. 2. Trump's rejection of global pandemic solidarity, what it means. 1. US rejects WHO pandemic changes, what it means for global health. The United States has taken a significant stance by rejecting the amendments made in 2024 to the World Health Organization's (WHO) health regulations, which were designed to enhance global readiness for future pandemics. This decision comes in the wake of the fragmented international response to the COVID-19 crisis, highlighting a critical moment in global health governance. On July 18, 2025, the U.S. Department of State and the Department of Health and Human Services issued a statement confirming that they had formally communicated the rejection of these amendments to the International Health Regulations, IHR, which had been adopted by consensus among WHO member states last year. These amendments aim to establish a new classification known as pandemic emergency, intended to address the most severe health crises that pose a global threat. The U.S. government expressed concerns that these changes were made without sufficient public consultation and would significantly expand the WHO's authority in managing public health emergencies. They argued that the amendments would allow the WHO to dictate pandemic declarations and enhance its role in ensuring equitable access to health resources. Critics of the amendments, including Secretary of State Marco Rubio and Secretary of Health and Human Services Robert F. Kennedy Jr., pointed out that the language used in the 2024 amendments is overly vague and broad. They warned that this could lead to international responses coordinated by the WHO that prioritize political considerations, such as solidarity, over the need for swift and effective action in health crises. Kennedy, known for his controversial views on vaccine safety, criticized the WHO during a video address at a separate pandemic agreement vote, asserting that the organization had not learned from the lessons of the COVID-19 pandemic. In May, a landmark global pandemic agreement was adopted in Geneva after extensive negotiations lasting 3 years. This agreement aims to ensure that essential medicines, vaccines, and therapeutics are accessible worldwide during future pandemics. It mandates that participating manufacturers allocate 20% of their vaccines, medicines, and tests to the WHO during a pandemic, ensuring that lower-income countries have access to these critical resources. However, U.S. negotiators withdrew from discussions regarding this agreement after President Donald Trump initiated a process to pull the U.S. out of the WHO, which is the largest financial contributor to the organization. This withdrawal means that the U.S. is not obligated to adhere to the terms of the agreement. In their statement, Kennedy and Rubio emphasized that their rejection of the amendments is a measure to safeguard U.S. sovereignty. They argued that both the IHR amendments and the pandemic agreement respect the authority of national governments over health policy and do not infringe upon national sovereignty. This situation raises important questions about the balance between global health cooperation and national autonomy. Are we witnessing a necessary assertion of sovereignty, or is this a missed opportunity for global collaboration in health? What do you think? Share your thoughts in the comments below. 2. Trump's rejection of global pandemic solidarity, what it means. *** Trump dismisses global pandemic response plans call for unity ***. In a significant move, the Trump administration has turned down a proposal advocating for solidarity in a strategy aimed at addressing future global pandemics in collaboration with the World Health Organization, WHO. This decision has raised eyebrows and sparked discussions about the implications of prioritizing national sovereignty over global health cooperation. In a joint statement released on Friday, Secretary of State Marco Rubio and Health and Human Services Secretary Robert F. Kennedy expressed concerns about potential, unwarranted interference with our national sovereign right to make health policy. This statement was made in response to proposed reforms by the WHO that aimed to enhance international health regulations. A key aspect of the proposed amendments was a commitment to solidarity and equity, which would focus on understanding and addressing the needs of developing nations during future health crises. This initiative is part of the International Health Regulations, a legal framework designed to combat diseases effectively. Reports indicate that these amendments were initially agreed upon during the World Health Assembly held in Geneva last year. However, the Trump administration has decided to withdraw the U.S. from this agreement, emphasizing a preference for prioritizing American interests. Kennedy articulated a strong stance against the amendments, stating, "The proposed changes to the international health regulations could lead to the kind of narrative management, propaganda, and censorship that we witnessed during the COVID pandemic." He further asserted that the United States can engage with other countries without compromising civil liberties, undermining the Constitution, or relinquishing the nation's cherished sovereignty. Rubio reinforced this sentiment, declaring, "Our agencies have consistently made it clear, we will prioritize Americans in all our actions and will not accept international policies that infringe upon our citizens' rights to free speech, privacy, or personal liberties." It's worth noting that during President Donald Trump's administration, approximately 400,000 Americans lost their lives due to the COVID-19 pandemic, a fact reported by PBS. As Trump began his second term in January, he made the unilateral decision to withdraw the United States from the World Health Organization, a move that has been met with mixed reactions. The Daily Beast has reached out to the Department of Health and Human Services for further insights regarding the administration's rejection of these amendments. But here's where it gets controversial. Is prioritizing national sovereignty over global health cooperation truly in the best interest of Americans? What are your thoughts on this approach? Do you believe that the US should engage more with international health organizations, or is it more important to focus on domestic policies? Share your opinions in the comments.